Jake, you and I shared stage at the summit. It was awesome. We sat knee to knee, and we just had a little 2-person panel. And you brought up some really, really cool stuff. One of the things that was really popular that you were talking about was, you know, when are the trigger points, or what are some of the commonalities that we should be looking for when it's actually time to add an associate for one, or expand your physical facility, or move on to a multiple practice. Those are some of the things that people are constantly asking us, but you had just a very, it was just like 2 slides, but you had a really cool way of talking through, like, here's some things to consider when bringing on a hygienist, to consider when bringing on an associate, to consider when expanding. Could you just go over some of those high points?
Sure. Yeah, no, that's great. So I always start with hygiene, because that's our line of patients. That's our bloodline of patients.
Mm-hmm.
And I start looking at how far is hygiene booked with the amount of availability that you have, whether it's 1, 2, 3, 4 columns of hygiene, really doesn't matter. This I call it the expansion stack. This applies to really any size of practice.
Mm-hmm.
But if your hygiene department starts being booked out right around that 3 to 4 week threshold at 85% or more of capacity, new patient availability starts to be pushed out further, where you don't have, the next new patient availability could be 2, 3, 4 weeks out. That starts to become one of the signs of this. But as you start to reach that tipping point, you really start opening up the conversation for another hygienist. And once you get to 100% of capacity, not looking at cancellations or no-shows, as you mentioned, Mark, mm-hmm. you have to set those aside, because that's going to happen.
Mm-hmm.
But if you're booked out for the next, I'd say a good solid, 25, 30 days plus in hygiene,
mm-hmm.
It's really time to start expanding